next week, Monday, we will be doing a part 2 of that topic, setting agenda for 2021 with those two gentlemen coming in, and they will be focusing more on the issue of restructuring, agriculture, and all of that. But now we want to change gear. We are looking at another very important topic in our national life at the moment, and we're looking at the second wave of COVID-19. We've got in the studio someone that should know how to face the challenge of the second wave of COVID-19, and that's ABDULRAFIU. ADENIJI is the president of National Association of Nigerian Nurses and Midwives. He's joining us on the program this morning. Alhaji, good morning.
Good morning.
Compliments of the season, Alhaji.
Same to you.
Good to see you. Second wave of COVID-19. I know those of you that are in that sector, nurses and midwives, are the ones that have been complaining so much. Doctors are dying and all of that, and we also know that nurses are also facing huge challenge, as far as dealing with, even the first wave. Now we're having the second wave. Now, what's the way forward facing the second wave of COVID-19?
Thank you so much. Viewers at home, good morning. When we talk about COVID-19, that we have lived with for the past 1 year, the way forward is that we must have learned from the lessons of the first wave of COVID-19. And learning from this experience, we are aware that presently COVID-19 does not have an actual preventive drug like vaccine that has been tested, especially in this country. But then, we have preventive measures that we have to take. Way forward equally includes that both the government and the people, equally the professional association, we have to be on the same page. We must all be committed to eradication of this COVID-19 in our space. Equally, we have to look forward as a new year and with a new wave to a government policy that will actually not only take care of themselves, but take care of the healthcare professionals and attempt to ensure that the Nigerian citizens are well educated about the menace of COVID-19, and equally to ensure that we have adequate networking within the government, at the federal, at the state, at the local government, to people in the private sector, the people who in the religious sector, and the traditional institutions, for everybody to be on the same page, to ensure that we contribute our quota to put the menace of COVID-19 at bay. We cannot say don't come to Nigeria now for COVID-19. It is living with us, with almost 89,000 people having been affected. And when we look at it, we just say that that 89,000 fraction of the population of Nigeria is not as if it's too big, but where are the infrastructure? Where are the means to treat these people? And that's why we want to thank everybody that has participated, especially the healthcare professionals, nurses, doctors, lab scientists, even the health attendants, mortuary attendants, and equally, even the people in the media that have always been on the hill to ensure that people have adequate knowledge about the menace of COVID-19, that it doesn't have vaccine for now. The only thing we can do is to ensure that there is preventive measure. If you don't come in contact with the virus, then it makes us safer than coming in contact and trying to probably manage the COVID-19.
Now, let us look at the vaccine you talked about. NAFDAC yesterday came out to say that it's not going to do any clinical trials for a vaccine that the country is going to procure for over 4 billion naira or thereabout, and that the only thing it's going to do is revalidation before it actually embarks on mass vaccination of Nigerians. And a whole lot of experts have actually disagreed with NAFDAC on that. What's the position of your association?
Well, clinical trial of a drug is very essential to ensure, because we cannot make human being a guinea pig. But the clinical trial, when it comes to this vaccine for COVID-19, Nigeria imported these vaccines. And probably the belief of NAFDAC is that the people that invented this vaccine must have done clinical trial. But I want to appeal to the authority in the country and the people who are the heads of affairs of NAFDAC, that it will not be too much for this country to do some clinical trial to ensure that people have assurance. However, with this, the revalidation the NAFDAC is talking about is another process, but it's lesser than the issue of clinical trial. The only very big crime that will come in here is that for the vaccine to be imported and there's no revalidation, no clinical trial, then we throw it into the market, then we are making our people a guinea pig.
Which is more important, revalidation or clinical trial?
Well, the one that has greater value is to do clinical trial.
That is more thorough.
That is more thorough. It goes through a lot of procedures. Validation is when you have already believed that this drug is safe, is potent, then you can validate it. That in the process of being conveyed down, is it what the people told us that is in the pack that is there? They will also do some experiments in validation, because there's every tendency that, okay, when the drugs are being purchased, they want to know, because there are protocols for even the importation. They want to know, is it the drug that were actually purchased that actually gets to Nigeria? So they will validate this also. And validation is not only for this vaccine. They have been doing it for some other drugs.
Now, just this morning we understand that there is spike actually in the deaths of
practitioners.
No, not even practitioners. Yes, in terms of the deaths we've recorded from COVID-19, and then just this morning, 33 persons died in just 1 week, and then just I think last week or 2 weeks or thereabouts, 20 medical doctors also died of COVID-19. Now, are your members, how badly affected are your members? Do we have such casualties from your end as well?
There is spike already in the occurrence, the incidence of COVID-19, and definitely you see it's like a mathematics. If you have less than 500,000 people affected, then the proportion of the people that will have died will be a fraction of that 500. But in a situation whereby we are having almost hundreds of 1,000 people being affected, then the fatality rate or the death toll will be on the increase. For a week, quite above 30 people died. Yes, the situation is pathetic though, but every right-thinking person who have been in contact with epidemiology, we know that this thing is not unexpected. The only thing is that it is catching us, let me say, unprepared again after the first wave. You talk about, definitely if you see the death of doctors, of about the number that was quoted, then you must think of, if not equal to that amount in nurses and midwives cadre, it will be more. Because nurses spend more time with these people that are affected. A doctor may come and evaluate the patient's prescribed drug. But the duty of care of this patient, most of it is with the nurses. Therefore, so far, quite about 4,000 nurses have actually come in direct contact with patients with COVID-19. And only out of this, only 2010 were able to be tested, not only from the government source. People who seek tests on their own and pay for the test are also part of this. And of these cases, so far we have about 265 nurses that have tested positive of COVID-19. Unfortunately, of these, our control room has shown about 13 nurses that have died. This was a statistics.
During the first wave?
From first wave to now.
Okay, 13.
The 13.
Nationally?
Nationally. And this is a very colossal loss. Because even the WHO has warned every nation to guard against the loss of healthcare professionals. Because the loss of any healthcare professional is drawing back the fight against COVID-19. Apart from the fact that that person is no more on the table to actually work, it instills fear in those people that is still there. The psycho-emotional defeat that is there can also increase the rate of occurrence of this COVID-19 thing. And when you look at it, it is very, very possible, because in this country, we must learn that this COVID-19 is an hydra-headed issue. And in combating it, everybody must be able to play its or her own role. As we are talking up to today, the federal government task force have not deemed it fit to actually engage professional association as it's being registered. They may pick one or two people because of the position they are holding in government. And you can never barb the head of an individual in the absence of that person. Not only this, country have not been able to actually coordinate and have a synergy within all the interventions that are coming in. Even professional associations, like National Association of Nigerian Nurses and Midwives, and some other healthcare professionals associations, are also contributing their quota either in provision of equipment or infrastructure that will aid the active control of this COVID-19. For my own association, we embark upon provision of sanitizer, mask, glove to be distributed to our members when the provision are not enough by the government. So what is happening in the country today, we should have learned lessons from even well-developed countries like America. America having about a quarter of the whole world occurrences. India, Brazil, Russia, following like that. But if we are not learning from well-developed countries that are being hit to the fabric, then we may be looking at a very long time before we end the issue.
What will you say to government in terms of preparation for the second wave? Now, coming with the second wave is, what we understand, is a new variant of COVID-19, and that makes it more challenging. What should government be doing, in realistic time, to actually prepare health practitioners and the health institutions for this second wave? Because let's agree that the first wave has gone, and the lessons are either learned or not learned, and all of that. But of course, there is still time for us to actually correct the wrongs of the past. What do you think, as a professional and as the man in charge of the chairman of this association in Nigeria, what do you think government should do to make sure that practitioners are safe as we face the second wave of this virus?
It is always the best to know that once you are stung by variants of any virus or insect, you know how it pains. Maybe we may not even be talking of the effort of the government today if the highly placed people are not involved as casualties. The government must be sensitive to the yearnings and aspirations of every Nigerian, especially the professional associations, who know what it takes. The professional associations have never stopped at alerting the government. They should take all these warnings, suggestions, contributions very seriously and ensure that we meet at a point. Of course, COVID-19 control and combating effort is a multi-sectoral approach. And the government must play its role by playing that coordinating role very, very well. What we have at hand now, presently, is the fact that we don't have, even from the first round of COVID-19, we have not have adequate procedures that will sustain the prevention of COVID-19. As we are talking, to take care of the healthcare professionals, when the federal government was sitting down and they said 3 months, the professional association told them it's not done like that. Nobody can predict the time this COVID-19 will go. Don't put whatever measure you are doing at these few months of May, June, July, or June, July, August. It must be a very long-term plan. The government must be ready to embark upon a long-term plan. And all professional associations and stakeholders must be ready to cooperate and collaborate with them. Like we are talking about what government should do to the health workers. The best thing the government can do to the health workers today is to provide adequate cover for them. So that wherever they are going to work, we know you can see that the rate of death of health workers in some developed countries are dropping now. Why must it be in Nigeria that the rate is now increasing? Because we are not taking adequate care of these health workers. As we are talking, every healthcare professional is supposed to use PPE. But all we have in Nigeria today is those who are only working at very close contact with the COVID-19 patient. And whereas there are people that are going about in the country that are carrying this virus. If you don't have adequate PPE, then what about other equipment that we have to use? As we are talking, Nigeria government is yet to conclude insurance scheme for health workers. Even those people that have died, you will just see that the way they are treating their case is with levity.
What stage are they? You said they are yet to conclude.
There is practically nothing on ground. It was just a pronouncement. And the only effort we could see is the House of Representatives, the Committee on Insurance and Actuary Services, that is trying to collect figures now. We shouldn't be at the level of collation of figures of people that have died or how many people that have been insured. And of course, no health worker owes insurance certificate as we are talking. We are just living on, if it happens, what do we think government can do?
Now,
and that is not supposed to be.
Now, health insurance, shouldn't it, for practitioners, shouldn't it be a norm, really? Should it be that it is when we have an emergency like COVID-19 that should even come to the fore? Shouldn't it be a norm?
It is supposed to be part of the standard operating procedures that people who are working in health sector are insured. But what we have in Nigeria is that there is a law that already established that people should be, health workers should be insured. And in fact, the National Health Act is not, it's not as if it's silent over this matter. But what we have in Nigeria is that there are a lot of lip services rather than practical application of whatever we put in place. Many people have always said that there are policies in Nigeria, but the implementation of these policies are not anything to write home about. The professional association have always been crying that the health insurance and not even what the law of this country put in place is not that only health workers All workers in Nigeria are supposed to be insured health-wise, so that when there is any ill health, the person feels safe to at least have access and be able to receive care without fear of where am I going to get the means. In Nigeria today, the healthcare funding is at the barest level, even compared to some African and West African countries. Even when we sat in Nigeria here and we said in 2001 that 15% of GDP be allocated to health, even when the National Health Act of 2014 allocated 1% to healthcare funding, you just see that Nigeria has out-of-pocket expenses of about 75%. Healthcare funding by budgetary allocation is less than 5%. Of course, it's around 3.5.
What do you make of that of 2021? The president just signed it into law, I think last week or thereabouts, and there is budget amidst budget of the pandemic, or what is it? How can we call it? Now, having a pandemic at hand, are you satisfied with what the government actually allocated for health? We can,
even from the beginning of the proposal of that, submitting the proposal, healthcare professionals have cried to government that this is an emergency situation, and every country is making emergency preparation. But Nigeria, we are just playing with the health of the health workers with this current signed budget, because it's nothing to write home about. Unfortunately, the only succor that will have come the way is the health insurance, and nobody seems to be very serious about it, even though when the federal legislators saw the need to make it very obligatory for every worker and every Nigerian to belong to. The catch net of National Health Insurance Scheme is still less than 5 to 7%, still less than 7% of the total people that are expected to be captured. So we have a very great danger ahead with this the budget. It cannot deliver us, it cannot get us to anywhere. And this is the point of calling on even the people in the federal legislative, both the green and the red chamber. They should look critically about the need of Nigerians and increase the budgetary allocation to it as just one aspect of healthcare financing source.
You have painted a very, very, very scary picture this morning. And for those that are watching us, they may really be having this, they may be scared about the new wave of COVID-19. Now, yeah, because you know that you are the very first point of contact. So many Nigerians are scared. But if you are scared, health practitioners, then what do you say about Nigerians that are going about their normal duties on the streets on a daily basis? Now the fear. Some states are saying, okay, for instance, Lagos State government is not opening, is yet to open, its offices to workers. The governor said that workers should still stay at home. Federal government is contemplating total lockdown again. Some states are also saying they're trying to make measures, new measures in place to fight the second wave of the virus. Now, are your people ready? Are they still willing? Are they prepared? Are they still confident of battling this second wave of COVID-19?
Well, Nigerians need to know that healthcare workers will sign contracts not only with the government of this country. As an healthcare professional, we have an oath that binds us. However thick or thin, and when you talk about nurses, you will know that where Nightingale got her fame was from participating in war and going even into the middle of the war front to take care of the sick and the wounded. So also we have a replicate in Nigerian nurses and world over. And this is why we cannot look away from patients, because we have a contract with the government that employs us. We equally have a contract with God, because in the oath of nurses and midwives, we say we solemnly swear before God in the presence of this assembly, because we know that Any life loss, if it is due to negligence or whatsoever, we are going to account for it, not only in this world, but with God. We also have contracts of duty of care to the citizens of the country, because we have chosen as a calling to be in this field. Equally, we have contracts with our conscience. As a result, we may be concerned, but we are not losing our head. We are not scared. It can only look, the situation may look so not interesting, but health workers are fearless soldiers who goes into the field to ensure that the first target is that let me save life. And I want to reassure Nigerians that as far as Nigerian nurses and midwives are concerned, and of course other healthcare professionals, despite all odds, we are prepared to face the COVID-19 second wave. And that is why in the first wave, the professional association goes into provision of certain things to cushion the effect.
Like what?
Like sanitizer, which is very, very important.
Face mask?
Like face masks, soap. We also provide gloves for our members, so that when they are going there, and then we provided some equipments like thermometer and everything, the digital one, that will ensure that they perform their work without let or hindrance.
How expensive was it for you to get all of those things, you know, or for government to actually get them for you?
Oh, for government, if the government actually goes into provision of these things, the government has capacity to manufacture some of these things, because we have many outlets that are prepared to do this. The only thing that we think that the Africa and Nigeria benefited from in this regard is that we are not, our economy is not that very strict by regulation. Because people can wake up today and start preparation of sanitizer if you have what it takes, and there are many on the field. But it has to follow the procedures. But in the developed countries, you have to go through a very strict process before you change trade. For the provision of all these things, if you plan ahead to get this thing equipped, to get the hospital equipped with adequate equipment and infrastructure, and with personnel, because there are no adequate personnel and some people are dying as well, it creates a very looming situation. When looking at Nigerian situation, with 200 million and about that Nigerians, we're supposed to have about 800,000 nurses and midwives actively serving. But today we have just about 125,000 actively serving Nigerian nurses. Out of these ones, people are migrating out of this country like mad. In the wave of COVID-19, the Europe, America, and the rest of them have they introduce an intervention program that aids the movement of people. People even come right away creating media to discuss with people right away from Nigeria here. And so we are losing even the little ones that are on ground. So the government must be prepared to increase, just like year 2020 by WHO was pronounced to be the year of the nurses and midwives. Equally, this year 2020-21 has been pronounced as the year of health workers generally. And in this, they want government to recruit more nurses, midwives, and other healthcare professionals. If all these things are planned for ahead, it will cost us what Nigeria can adequately finance. But if we are going to emergency purchases, it may increase the cost of procurement of all these equipment. And any person that does not plan is only planning to fail. And we don't pray that for the health system of Nigeria.
Now, the PTF, sometimes in December, was actually saying January might actually be tough for the country in terms of this second wave of COVID-19. And then the papers this morning said lockdown might actually be imposed whether it is national, maybe it is
For states.
for some states that are
Epicenter.
epicenters of the virus. Now, some people are of the opinion that if we are not getting the high number of casualties as other countries who have imposed lockdowns, from February when we had our index case till this present moment, we have only recorded 1,311 deaths. Now, what is the essence of locking down? We should actually develop our own approach to containing the virus. Do you think we should actually be doing that, or we should go for the lockdown?
About 3 things is very important when we are talking about management or control of this COVID-19. The first one that we need to know is that the best measure is for us not to come in contact with the virus at all. And all government is trying to do is to reduce mobility. Anybody affected that is traveling all about is spreading the virus. Unfortunately, we didn't learn from the last episode, and as a result, people are not complying with the rules of distancing. We must know that this issue of virus takes about 3 stages to care for. Then we are out of these words: your hands, your face, and the space. If you're able to maintain this, then there is no problem. But what government is planning towards in terms of lockdown, even during the lockdown, Nigeria was only able to curtail mass movement. People are still not complying with the preventive measures. The adequate washing of hands, some people turn it into something just like a child play. People are even denying the existence. People will even just, when you get to where the hands is to be washed, they just put it there as if the security agents are watching you. You leave. And if we are not gaining from this, even the use of masks, when you go to some of the malls and the rest, people don't keep the adequate distance that is expected to be kept. And you still see people poking their nose, putting their hands into their mouth, and then rubbing their face, just like that. Even the use of the mask, people use it in a very bad way that can even contribute to the spread of this to the spread of this virus. Because you see people, they use masks today, they put it in their pocket. And whenever they get to where they have to use it again, they remove it and use it again. It's even bad. That's false reassurance. And as a result, we must know that the only option left for Nigerian government is this lockdown. But if we can appeal to the masses of the country,
that's what we want you to do now.
To know what it takes. If we are going to that, educating the masses, we must know that this viral infection takes 4 stages. The first stage is 0 stage. When you have not contacted it at all, maintain the space for you not to contact it at all. The second phase that is so critical is when you, by virtue of touching anything, formalin, or you come across it by accident with your hand and you introduce it. The first space it goes to is when it is at the nasal stage. We must monitor all these things with the symptom. Your hand, you have to go an extra length in the environmental hygiene. Then personal hygiene starts from the hand. Some people are still keeping very long fingernails. We have to take this hand hygiene very serious. After taking the hand hygiene very serious, we have to know that immediately you get in contact, we have finished the 0 stage of contact of the virus. Now the stage of contacting the virus, the nasal phase. You see sneezing, you see runny face, and runny nose. And at this stage, just ordinary less than 200 naira worth of material can just get rid of this thing. By hot inhalation, very good one. And making sure that you take alkaline base materials When it let that space is going into the throat, even at the throat, if you do good fermentation, you can still get rid of this thing with all the drugs that will be provided. But when it gets to the lungs, we must know that whoever is there, you have to be your brother's keeper. If you have tested positive, make sure that you don't get in contact with another person. And that comes for the issue of self-isolation. People are not very religious about the self-isolation thing, and Nigerians must note this. Even some families, they will say, Chebi is my family. They will go and be interacting. Whereas the immunity of that person may be better than yours.
Okay,
so the fragility may be more.
Exactly.
So the public must know that all it takes is for us to maintain all the questions that have been thrown out by the day.
We must really thank you, Alhaji, for coming on this program. President of the National Association of Nigerian Midwives, Alhaji ABDULRAFIU ADENIJI, thank you so much. I think your last words actually hit the nail on the head, and those are the messages that Nigerians really want to hear on today. So we must thank you so much for coming on this program.
Thank you so much.
John, you have to go.
Yes, we also thank you for staying tuned to the People's Daily. Have a wonderful year ahead.